My name is Corey Lanes,
I'm Kelly Peer.
and we're presenting on HIV and AIDS.
So HIV stands for Human Immunodeficiency Virus, and AIDS is Acquired Immunodeficiency Syndrome. Basically the same thing. It weakens the immune system by destroying important disease-fighting cells known as our T cells, and it's transmitted through sexual activity or syringe needle use, and this could be through blood, reproductive fluids, breast milk, or rectal fluids from an infected person to a mucous membrane damaged tissue or injected directly into a bloodstream of a non-infected person. Prevent spreading HIV and AIDS by using condoms or taking medicines to treat HIV is ART. 3 types of testing: antibody test, combination or 4th generation test, and nucleic acid test. And those are performed in the blood, oral fluid, or urine. Throughout the world in 2006, there were 39.5 million cases, and that was 37.2 adults and 2.3 million children. 17.7 million of these were women, and 5,500 were infected day to day, and 3,000 died on a daily basis. 95% of these cases are from developing countries. In 2008, this decreased to 33.4 million cases worldwide and 2.7 million new cases, or 7,400 each day. And there are 2 million deaths throughout this year. By 2015, the world saw the fewest number of deaths or newly infected people since 1991. The main groups affected are those in developing countries, homosexual men, women of color, and racial ethnic minorities. And this is a graphic to show how the numbers have changed throughout the years, starting back in 2000, where there were 3.2 million people, and then all the way down to 2030, where there's supposed to be less than 200,000. In just the United States, there were 1,210,835 Americans who had AIDS, and that's about 0.4% of the total population. And most of these cases are in New York, California, Florida, and Texas, which is 50% of the total cases throughout the country. And this graph shows how many deaths were recorded that year as well, and it ended up being about 0.5% of everyone that had AIDS that year. And again, you can see the New York, California, Texas, and Florida are highlighted as some of the top states with the most amount of deaths. And since women are one of the main groups affected, this just talks about how in 1992 there were 14% of women from adults and adolescents of all cases that year. And then in 2004, that jumped to 23% of all cases were women. So over the years, women are becoming a larger majority of the people with AIDS, and this table shows the ethnicities that are affected. In 2013, the CDC's annual report reported that they received $741 million just for HIV prevention, and the majority, about 86%, went to their division that just worked on prevention programs, while the other 14% went to public health service evaluation and projects with similar diseases like STDs and whatnot. And in 2014, they reported similar, but they increased their funding to $789 million, and 87% went to these prevention programs, and 13% went to the same evaluation and projects. But in 2015, they funded 61 grantees, totaling $306,777,795 for HIV prevention programs, and In 2016, they increased that by $12.6 million. And this is a pie chart of their budget. And the main chunk, the $789 million, is the HIV/AIDS prevention and research, and the other three are those other projects that they included in their reports from 2013 and 14. And this is just a breakdown of their projected budget for 2017. There's $789 million for just the domestic HIV/AIDS prevention and research. So most of it's going to go towards the HIV prevention by health departments, the $397 million, but $120 million is going to HIV surveillance, $103 million for activities to improve program effectiveness, $135 million for national, regional, local, community, and other organizations, and $33 million for adolescent and school health.
So, comparison of treatments for HIV and AIDS. First, the umbrella is ART, or antiretroviral therapy. ART is a combination of medications designed to control HIV but not cure it. It allows people with HIV to live longer, happier lives, as well as reduce the risk of spreading. Mainly, this helps people because, they can't cure the disease, but these medications and therapies will make it so they can live longer, and it doesn't stop the spread, but it does slow it down, and it also reduces the risks by actually decreasing the amount of HIV infection that you have in your system over time. The treatment works by limiting the multiplication of HIV in many different ways. There are 6 classes of drugs that go into this treatment. The 6 classes of drugs involved in ART are non-nucleoside reverse transcriptase inhibitors, nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, CCR5 antagonists, integrase strand transfer inhibitors. All of these drugs function with an objective at limiting the development and or multiplication of HIV, but none of them actually stop or kill HIV. Protease inhibitors specifically are one of the 6 ART drug classes. They work by blocking protease channels, which prevents immature HIV from maturing and infecting other cells. This chart right here shows how protease inhibitors work. You can see from that CD4 cell, an HIV protein kind of pops or comes out of it after it's fully matured, and then the HIV protein then is going to go look for other CD4 cells. But what this protease does in it, you can see right here, this purple dot, it actually is transcribed into the DNA of the cell, and it actually hinders or stops that HIV cell from fully maturing, and thus not allowing it to actually be able to attach and go into a CD4 cell and infect it. So that's one way the PIs work. So Aptivus is an example of a PI that is on the market today that people with HIV can buy and use. Aptivus was developed by Boehringer Ingelheim. Its generic name is Tempranildir. Dosage for adults, it's administered orally. It's 250 milligram tablets plus 200 milligram Norvir tablets twice a day. It works like other PIs, and an example of that is what I just showed you on the previous slide. Place in therapy, Aptivus specifically is only approved for use in patients who have tried other PIs and failed. It is not for patients who have never had treatment for HIV. It must also be used in combination with other HIV drugs. You can see that with the dosage above. Not only do you take 2 tablets of Aptivus, but you also take 200 milligram tablets of Norvir. And that is true for a lot of the 6 classes of ART drugs, that they all need to be taken in some sort of combination to really have the maximum effect in terms of slowing down the growth of HIV and the multiplication of it. PIs versus nucleoside reverse transcriptase inhibitors, or NRTI. NRTI is another one of the 6 classes of ART drugs that I spoke about earlier. NRT works by inhibiting the HIV during the duplication process and disrupting it, to which it slows down that process altogether. Both have a similar operating goal in that they cannot cure HIV or AIDS, but they can slow it down, and they are able to do that as long as people stick to adhering to the drug as prescribed. Abacavir is one of the NRTI drugs on the market. Its generic name is Zygen. Its dosage is 300 milligram tablet taken orally once a day. And yet again, this is another drug where it's used in combination with other the ART drugs that are in those 6 classes. They all work together to create the best possible outcome for the patients. Here's a diagram of how this works. It actually is within the CD4 cell where this takes place, and it stops the duplication of these HIV cells right in the spot, as opposed to where the PI would actually let an immature HIV cell out. This CD4 or this treatment actually stops them from even getting out, so it slows them down further by affecting right at the source. So you can see that in this diagram. Business perspective, HIV/AIDS currently does not have a cure. Currently, the only treatment for HIV/AIDS are drugs that must be taken consistently and for the remainder of a patient's life to slow the disease down at a manageable rate and allow them to have the best possible life for the time that they have. This makes the creation and sale of HIV/AIDS hindering drugs critical and potentially lucrative for companies that are able to create an effective drug that a person will have to take for the rest of their life. Patients will always need the drugs, and once they start on the treatment path, they will stay on it for an extended period of time, which leads to pharmaceutical companies knowing that their drug will always have a demand. Treatment comparison. Just like I said earlier, a lot of these treatments are used in combination, but some of the combinations can be different, and the prices ranges definitely differ from drug to drug. For example, the PI treatment option, Aptavis, is one of the options you can have. It costs $1,685.59 a month for 120 250 milligram capsules. So for 1 month, that's a pretty steep price. When you compare it especially to the NRTI treatment option, Zygen costs $670.37 a month for 60 300 milligram tablets. You can tell that those are obviously much different numbers, but a lot of them do have to be used in combination. So treating HIV or AIDS is a very expensive prospect, and it can be tough for people who suffer from it. This makes effectively treating HIV and AIDS very expensive because you really can't just take the cheapest option. You really can't just only have one option. You really have to expand your treatment and combine the different 6 classes of drugs in as many ways as possible to slow down the HIV spread. Thank you.